Welcome back to Expresso on a particularly magnificent day in Cape Town, live on SABC3. We've got some hollow spaces in our faces, around our eyes and our cheeks. Paris Hilton has got hollow spaces elsewhere in the head, but we're not talking about that this morning. We're talking about sinuses, and in fact sinusitis, which is an inflammation or infection of the lining of the sinuses and causes particular pain in the face. Now that's usually the realm of the ear, nose and throat specialist, but this morning we have an osteopath with us to talk about alternative ways of treating sinusitis. Dr. Guy Ashburner, thank you so much for your time.
Good morning, Michael.
Tell me a bit about what an osteopath is or does.
An osteopath is a well-established physical therapy. It's been around for a long time, since 1874, in fact. If you come see me with a pain, for instance, your knee pain, for instance, we look at your hip, your ankle, your foot, and your back, come to a conclusion, and then treat it. Not necessarily just treating the knee.
Great. So
but it's involving a diagnosis. We do a thorough examination.
Fantastic. And treat the whole body.
Absolutely.
All right. So how does sinusitis come into that? Tell me a bit about osteopathy and sinusitis. You know, why we have these sinuses in our body. And
the sinuses are spaces in our face. So for instance, we've got the maxillary sinuses here, behind the cheekbones. We have the frontal sinuses up here, ethmoidal sinus, and then sphenoidal sinus behind that.
Okay.
The sinuses are lined by a mucus.
All right.
And this mucus protects us from infection, dust, and so on. And the inflammation of this is sinusitis.
Okay, so what sort of symptoms do you get with sinusitis then?
With sinusitis in a child, what we're going to do, we might present with a cough or stuffiness or congestion. In an adult, as well as the child, we might get pain in the face, puffiness around the eyes, a foul taste in the mouth or nose, that sort of thing.
And usually the first thing people do when they get that is go and get it treated. I go to the pharmacist or whatever, I need something just to take this away. But there are other ways of treating that, aren't there?
That's right. So can I just go on about the causes?
Yeah, sure.
Causes, we've got basically causes. We've got infection, we've got structural changes in the face, we've got allergies, and we've got environmental considerations. Now, in terms of structure, you might have a blow to the face, you might have had a difficult delivery at birth, you might have had forceful dental extraction, whiplash injury, that sort of thing, or you might have a polyp in there, or you might have a tumour, that sort of thing.
All right.
In terms of infection, you might have a respiratory tract infection or a cold, and that tracks up along the membrane, giving you the sinus. Okay. And basically it tracks up through the little fissures in the sinuses to give you the congestion in the nose.
All right.
Then allergies with dust, pollen, dirt, any of that sort of thing, as well as heaters. Blowing out cold air, hot air.
Right. Hot air. Okay, so a whole bunch of causes that can cause
Absolutely.
sinusitis, and a whole bunch of ways of treating it too. Let's steer clear of medication. Let's talk about the osteopathic approach to sinusitis and managing it.
In life, all the bones in the face move as all the other parts of the body move. So like your rib moves, your face will move to a certain degree.
Okay.
If we get a reduction in movement in the face, you're going to get a reduction in function. Therefore, what we do as an osteopath, we try and maintain that function, as well as moving the face bones. We allow the drainage from the head and the neck to function normally, so the body can actually, if it's pumping and moving, it's likely to function. If it's not moving, then we're going to get a reduction in function and lead to things like chronic sinusitis.
Okay. Well, my obvious question was, how do you get the face bones to move? But maybe you can give us some other advice around sinusitis.
Okay, a little trick you can try, possibly, everybody can try this at home if they like, is basically to stick the tongue on top of the palate, like that, then place one finger between your eyebrows, like so.
All right.
And just pulse up and down with the finger and the tongue for about 20 seconds. So what you're doing is rhythmically moving the vomer bone in the mouth and the ethmoid bone here.
Okay.
And that should, after about 20 seconds, give you a drainage of the sinuses.
Wow. I can feel it coming through my nose already as we speak. Guy, thank you so much. Fascinating stuff. Alternative medicines are great, or other ways of treating it. So there's the message for you this morning. If you do suffer from chronic sinusitis particularly, and it's not structural, then there are other ways of treating sinusitis other than medication. Right now, we're going to traffic, so stay with us on Expresso.